nation, under God, indivisible, with liberty and justice for all.
I'll call the regular city council meeting to order, and I'll entertain a motion to approve the agenda.
So moved. I move for so moved.
And a second.
Second.
It's been moved and seconded. Any further discussion? All those in favor signify by saying aye. Aye. Those opposed, same sign. Motion carried 4-0. Public forum, limited to agenda items only. Does anyone wish to address the council? There being none, I'll entertain a motion to approve the consent agenda.
So moved.
In a second.
Second.
Okay, it's been moved and seconded. Any further discussion? I'd like to recognize that we've got a service appreciation for Margot for 5 years of service with the city
Thank
of
you.
Marion, although she served the city for many more years than that, so.
In 27 years is the first time that's happened, thank you.
That's pretty nice. I just have a quick question for Tiffany. Tiffany, explain me why we're still running two sets of phones, one for US Cellular and one for Verizon.
Well, US Cellular is our city cell phones that everybody receives.
Okay.
Verizon is our office phones.
Okay.
We went away from AT&T and we use a voice over IP system in the office, and that's what the Verizon bill is now.
Okay.
There were still two on the billing you're seeing there, two cell phones that had been replaced in the PD, and if we ported those over when we did the others from US Cellular, we would have had to pay the early termination fees on that contract.
Okay, well, I noticed on Verizon, we have like, Jan and Becky and Randy and Margot, list them our city shop, fire chief, so on and so forth.
Right, our office phone.
But like Margot, or, they're not having two phones, are they?
You have your office or your desk
Desk
phone,
phone.
and then your cell phone.
Okay, all right.
So, I mean, if you look at it like that, then yeah, we each
Okay.
have two, but the cell phones that Roger's talking about for the PD, we actually ported over at the end of the year, so that takes care of those and will all be on US Cellular now.
Okay, sounds good, thank you.
You're welcome.
Any further discussion or question?
I did have one more.
Okay.
What piece of equipment was down to Williams Services? Is that a loader or what? We have a repair bill of $569.15.
Let's see. Yes, that would have been a loader, that's paid out of street and alley budget.
And you don't know which loader it was, do you? Is it our big one?
Let me see if I can look real quick.
You can email me later, Jeff.
Okay,
Would please.
I'll do that, cause I just got an error.
Okay, one more question, Mr. Mayor.
Okay, anyone else? We have a motion with a second to approve the consent agenda. All those in favor signify by saying aye. Those opposed, same sign. Motion carried 4-0. Item number 6, we got mayoral appointments, community boards. We have a board of zoning appeals appointment. I'd like to reappoint Bill Lundy to that position. It's a 3-year term and expires 12/31/2023. I'd entertain a motion to approve that appointment.
So moved.
Second.
Second.
Any further discussion? All those in favor signify by saying aye. Those opposed, same sign. Motion carries 4-0. We have a second appointment to the planning commission of Darvin Markley to a 3-year term, which would expire on 12/31/2023. I would entertain a motion to approve that appointment.
So moved.
Second.
Been moved and seconded. Any further discussion? All those in favor signify by saying aye. Those opposed, same sign. Motion carries 4-0. And the last one I have is Josh Clevenger for the planning commission. It's a 3-year term, and it will expire on 12/31/2023. Okay, a motion for that.
So moved.
Second?
Second.
Been moved and seconded, all those in favor signify by saying aye. Aye. Those opposed, same sign. Motion carries 4-0. Number 6, resolution 20-01, waiving the gap requirement for 2021.
Is that 7 or is that 6?
Mr. Mayor, can I just add something to this previous?
To the appointments?
Yes.
Sure, go ahead.
I'd just like to know how our zoning administrator is working out. He's an interim, and I'm just wondering, are we gonna think about appointing permanent? I've heard a lot of good comments about him. That he really checks out things and works with people, so I was kinda wondering where we're at on that. Are we still looking?
I think it's still interim at this point in time, but he's learning as he goes.
Yeah, but-
I don't have a whole lot of information yet. I haven't talked to the planning commission and the zoning board of appeals. So I really don't have any information in regards to that.
Well, I know we made, Tim Moskovich permanent or promoted him to supervisor after 90 days, and I thought maybe this would be the same thing.
Right.
It seems to be working out good. I've heard a lot of good comments about it.
Okay.
But if you wanna take the time to, visit with the planning commission and stuff, I understand that.
I think we've got a meeting with them the 26th.
26 is where I,
Okay,
have been invited for that meeting as well as, Randy Collett
And Tim Makovich.
yeah, and,
okay, then maybe you can bring it up at that time and
Okay,
discuss it with the board.
all right, we'll do that.
Thank you.
Number 7, Tiffany.
In your packets, we have a resolution 21-01, and it's just yearly, exemption from the GAAP accounting, which is not what our auditors or the city of Marion use. We use the KMAG accounting, principles. So we just have to waive that every year.
Okay, any questions?
Who are our auditors?
Swindle, Jansen, Hawk, and Lloyd.
Okay, is that why I have an envelope from them today?
I
Okay.
got
Yep.
one too.
I was like, what is this about?
Yeah, no, they started
That's the
their
only
prep
thing.
already and everything, so.
Okay, all right.
Yep.
That's the only question I had.
Any other questions? Entertain a motion to approve resolution 21-01, waiving the gap requirement for 2021.
So moved.
Been moved and seconded, any further discussion? All those in favor signify by saying aye.
Aye.
Those opposed, same sign. Motion carried, 4-0. Number 8, resolution 21-02, lease purchase agreement with Marion National Bank. Tiffany?
Could we have Chief start before Tiffany talks tonight?
Last meeting, you guys approved the RFP from Marion National Bank, and this is the lease purchase agreement. I know there were some concerns, last council meeting, so I did a little bit of follow-up. And I was able to obtain the title for the vehicle, and it's not a salvaged rebuilt title, it's a regular title. And then I was able to go to Ford, and they use Oasis as their warranty software, and they printed out the indication that has a 5-year, 60,000 mile,
Great.
powertrain warranty.
Do we know when this vehicle's going to be completed?
It's completed, and we spoke with the guy today, and I told him everything, if everything goes well, the council meeting, we'll be able to go, he said he would meet us halfway, which it was in Joplin, so halfway was, we determined was Fredonia. And he said he would meet us there on Thursday, and we'll look at it there and go for it, if you so desire.
Assuming you'll approve the
Correct.
lease purchase agreement.
Correct.
Okay, but where is the lease purchase agreement? I looked clear through my packet and couldn't find it. All we have here is a resolution.
Right, the
We don't have the
resolution,
agreement.
the resolution approves us to execute the lease purchase agreement.
We approved the proposed lease purchase last month.
Right.
And it said in the minutes that the lease purchase would be presented to the council today, and I couldn't find it.
Well, I have a copy of it if you wanna see it.
I would take a copy, period, I'll just take a copy of the whole thing.
Okay.
When you get done, okay?
Okay,
Thank you, appreciate it.
Any other questions? Entertain a motion to approve resolution 21-02 lease purchase agreement with United National Bank.
I so moved.
Second,
Second.
been moved and seconded, all those in favor signify by saying aye. Aye. Those opposed, same sign.
No,
Motion carries 3-1.
Thank you.
Item number 9, ordinance 1470, franchise agreement with Atlas Energy. Roger?
Okay. We have had an agreement with, initially it was issued under Freely Gas, who was acquired by Atmos for a period of 20 years. That, franchise agreement expired during the COVID stuff of last year. We've got it all worked out to move forward with the lease agreement, the franchise agreement with Atmos Energy to provide natural gas services in our city. As part of the agreement, it gives them access to our right of ways, so forth, to run their lines, work on it. And in return for that agreement, we receive 3% of whatever, their billables are within the city limits of our city. So we would encourage you to authorize this. The term is a little different. Instead of just a flat 20 years with, pricing the 3%, we're going to 5 years with, additional automatic renewals if requested by either party.
What's an annual total for the franchise fee?
16 and 18 is what it's been running.
1,000.
Yeah.
What actually happens to this money, Roger? Does it just go into general funds or what?
Correct. Yeah, we use it as part of the other income line, and it goes directly to the general fund to some police, fire, yeah. It's a way that we try to offset part of the ad valorem taxes.
I was just kind of curious because I figured a year's gas bill for me and it comes to $18 is what my share of the 3% would be, so.
And we've got 1,000 taps, so it comes up.
Yep.
Any further questions? Entertain a motion to approve ordinance 1470, franchise agreement with Atmos Energy.
So moved.
Second,
Second.
been moved and seconded, any further discussion? All those in favor signify by saying aye. Those opposed, same sign. Motion carried 4-0. Number 10, Blue Cross Blue Shield Health Insurance Renewal Proposal. Kelly? Thank you.
Well, thank you for letting me come out today to go over, your renewal information. The city's plan with Blue Cross and Blue Shield does renew March 3rd. And so on the left-hand side of the packet that I handed out to you all is a summary of your current plan versus the renewal. And you currently offer 3 different options that the employees can choose from. There are no changes in the current benefits as far as the deductible amounts or what their out-of-pocket is. But you will see then you have the monthly premiums listed. And you have the 4 tiers: employee, employee, child, employee, spouse, family. And then we have figured that total on a monthly basis and then an annualized amount. So on the health insurance side, we are looking at an 11.44% increase. To give you a breakdown on that, you're part of a small group pool, so we're looking at your group's demographics, which is age and gender, we look at your group's utilization, and then we also do look at, the small group pool that you're a part of. So the percentages I got for this renewal is 7.4% was a change in the group demographics, and the rest was the pool adjustment. You'll see there at the bottom, we did list the, annualized dental, and the dental is down a little bit. So that is both included on that summary piece. I think the easiest is just kind of working through that information. There is a piece behind that with the 2021 contract changes, just so you're aware of things that we are implementing across the board. Blue Cross, starting at anniversary March 1, we will cover electronic prosthetics. There is a medical policy in place, so that would be reviewed on a case-by-case situation. Residential treatment centers is just another layer of inpatient, nervous, mental, alcohol, drugs, and we have added eligible providers for that. The manufacturer coupons, some of you might have heard about like the savings cards you get from some pharmaceutical companies like Humira or Enbrel are two big ones I see, where if you take their medication, they'll pay a big chunk of it. And this is just outlining in the contract as far as what counts towards a person's out of pocket, a member's out of pocket, is only what they physically pay. They're not gonna get credit for any coupon amounts. With your plan structure, I don't really see where that would come into play, but just so you realize that that's what that is explaining. And then really the only other thing, the diabetic supplies at the bottom, Lancet devices used to stick the fingers, those were covered under deductible and co-insurance. March 1, that is going to move to the prescription copay. So I think those are all positive adjustments for the new year. The rest of the information in there, it just gives you a plan feature piece on the health benefit. It does give you the benefits on the dental, but nothing has changed on the dental. And I guess I should ask if anybody wants me to go into detail as far as the different options or deductibles, how that works, or are you guys all pretty comfortable with that? Okay. One thing that I've really been reminding everybody about is the telemedicine. So that is either through the online vendor Amwell that people can access and download the app. That also applies to local physicians if somebody is offering telemedicine, and I know that has increased through COVID. So if it is billed as telemedicine, that is covered. Through the Amwell app, it is a $25 copay. And if it is a local provider, we do a co-insurance reimbursement. So Blue Cross will pay 80%, the member will pay 20%, and typically that still works out to be around that $25 mark. Your group does have preventive services covered at 100%, so I did include the list of the preventive services. So what that means is the screenings and tests that are covered under the Affordable Care Act as preventive, as long as they are coded as such, the member does not have any out-of-pocket for those tests. But I just always stress it's very important, it all has to do with coding, and that it has that preventive code. You guys are what I call grandfathered enhanced, so you're still technically a grandfathered group, but you do have the benefit of those preventive services. A conversation to have as far as your grandfathered status, the rules are still the same. So everything goes back, it's a look back to March 23rd, 2010 when the law went into effect. And to keep your grandfathered plan, you cannot make any benefit adjustments. And the other part of that is contribution. Whatever percent the employees were paying, but you guys pay the single, okay. you cannot pass on more than 5 percentage points of the total premium. So you're paying 100% of the single now, you'd have to at least always pay 95% of the new premium. Does that make sense? To keep your grandfathered plan. Okay? Also, your grandfathered plan is a compiled rate looking at the utilization of the whole group, and so you just have those 4 different tiers of rates. I did want to show you the discussion Roger and Tiffany and I had as far as plan options. Because obviously with an 11% increase, we wanted to see, explore what else was out there. So on the right-hand side of your packet would be some non-grandfathered options. And I think some of you have already seen the rating is different. So when you go to a non-grandfathered policy, Blue Cross can only rate off of age. So you put in a date of birth for the employee and any family members they cover, and that's what their premium is. You have the 3 different plans right now, a $500 deductible, a $1,000 deductible, and a $1,500. For comparison purposes, we've just plugged in the same enrollment numbers for that choice 1, choice 2, choice 3, because that would keep things the closest. When you do that and move to the age rating system, you would be looking at a 47% increase. So significantly higher when it changes the rating. We also did have some discussion on kind of a form of self-insuring. I'm not sure that's worth the risk, because you ultimately give up your grandfathered status if you make that decision. So if down the road that does not end up working out for the city and you want to move away from it, you would have to go to one of these non-grandfathered plans that are significantly higher. So really, my recommendation, looking at the different options, I would say staying grandfathered would be the best choice at this point in time, when you look at the numbers. But like I said, I wanted to give it to you guys and make sure if you had any questions that I got those answered. There is, along with that summary on the non-grandfathered, there is a census of everybody on the plan, so you can kind of see how that rating looks by age. I've included that also per person, so. The life insurance, you do have $15,000 term life and accidental death and dismemberment through our subsidiary company Advance, and there is no rate change on that. The life insurance stays the same premium. So with that, I will take any questions that you might have.
You mentioned the increase of 11%.
Correct.
How much of that was age, how much was usage, and how much was just inflation? Do you have any idea?
Of the 11%, 7.4% was based off the change of age and gender for the group. They do a blend, it's not just strictly age. And then the rest was the pool adjustment. So they look at utilization overall for our book of business and what rates need to be for that type of plan. And they do a pool adjustment on all groups across the board. So you did not get anything on utilization.
And Chris, the base for the group is basically the inflationary factor that's applied, and then because we all got a year older.
Yeah, basically.
We're having birthdays.
Yeah.
I was glad with that.
When they turn 65, how does that change they quit being included in the age rating?
If they are still actively on the plan, their age is included.
Okay.
If they go off of the city's plan and take a Medicare supplement, for example, then no, we do not include them at that point.
Can our employees jump around from year to year on which deductible and?
Absolutely.
If they
Yes.
live in
That is a good question, yes. This is what we call an open enrollment period. And so people can elect to take one of the different deductible options. We used to have restrictions that they could only like move up or down one level, and we've done away with that. So now they can move to any of the 3 plans.
And they can have family or take family off during this period.
Thank you.
You're welcome.
Roger, tell me again how much we actually pay for the employee
For the employee themselves, we
100%.
pay 100%.
and the spouse? The
For,
spouse,
for all dependents, we pay 25% and they pay 75%
For help.
for help.
And that 5% adjustment that I was referring to is only on the health side. Dental falls outside the Affordable Care Act, so. And just like the single, with you paying 25% of dependents, you can only move away from that 5%.
And our recommendation is to renew at this. For budget purposes, we had anticipated a 10% increase, and the budget was accordingly, so we've got 1.44. It wasn't specifically budgeted for, but we'll make the investments within operations, rather than have our employees and their families go through a change in a time that's been very,
sorry,
yes. So we would ask for your approval to go ahead and renew under our existing grandfather enhanced program. And the enhanced means that we now cover, when we got into this 10 years ago, we didn't cover for many type procedures. That is covered under our plan now, so I guess if you need 19 COVID tests because you
Well, and you know, I'm glad you mentioned that, not to interrupt you, but just to address the COVID situation, Blue Cross has all of our information out on our website, and we are keeping that up to date, and so you guys are aware. We are covering COVID testing, the antibody test, and treatment through March 31st. That was extended, it expired at the end of the year, and they made the choice to extend that through March, and then that'll be reevaluated again. So, that's nice that people can get their testing and taken care of without having to worry about it.
Any other questions? Is this is listed as a proposal, is we need action on this tonight?